Post-traumatic stress disorder, PTSD. Post-traumatic stress disorder, or PTSD, occurs after someone has experienced or witnessed a traumatic event. Symptoms can include flashbacks, nightmares, and severe anxiety, making it hard to function in daily life. Many people associate PTSD with soldiers, but it can happen to anyone who's faced trauma. Therapy, especially trauma-focused therapy, is a key treatment. Schizophrenia. Schizophrenia is a serious mental disorder that affects how a person thinks, feels, and perceives reality. People with schizophrenia may experience hallucinations, like hearing voices or seeing things that aren't there, and delusions, which are strong beliefs that don't match reality. For example, someone might believe they're being followed or that they have special powers. Schizophrenia often starts in young adulthood and can make it difficult to work or engage socially. Antipsychotic medications are the primary treatment, and they can help manage symptoms. Bipolar disorder. Bipolar disorder involves extreme mood swings, ranging from manic highs to depressive lows. During manic episodes, individuals may feel euphoric, have tons of energy, and make impulsive decisions. During depressive episodes, they may feel extremely down, similar to someone with MDD. These cycles can be disruptive, but medications like mood stabilizers and psychotherapy help people manage the condition. Borderline personality disorder. BPD is a condition marked by intense and unstable emotions. People with BPD often have difficulty regulating their moods and may experience rapid shifts from anger to sadness or anxiety to happiness. They may also have unstable relationships, intense fear of abandonment, and engage in impulsive behaviors, such as reckless spending or self-harm. Living with BPD can feel like being on an emotional roller coaster, but with dialectical behavioral therapy, a specialized form of therapy, many people with BPD can learn to manage their emotions and build healthier relationships. Autism spectrum disorder. Autism spectrum disorder, or ASD, is a developmental disorder that affects communication and social interaction. People with autism may have difficulty understanding social cues, making eye contact, or participating in typical conversations. They might also engage in repetitive behaviors like hand flapping or have specific interests that they focus on intensely. Because autism is a spectrum, symptoms can vary widely from mild to more severe. Early intervention, including speech therapy, occupational therapy, and behavioral therapies, can help individuals with ASD thrive in their own unique ways. Dissociative identity disorder. Dissociative identity disorder, formerly known as multiple personality disorder, involves the presence of two or more distinct identities or personality states. People with DID may feel like they have different selves who control their behavior at different times. This condition is often linked to severe trauma in early childhood. Treatment usually involves long-term therapy to integrate the identities. Eating disorders. Eating disorders involve extreme concerns about weight, body image, and food. The most common types are anorexia nervosa, where people severely restrict their food intake to lose weight, and bulimia nervosa, where individuals binge eat large amounts of food and then purge through vomiting or excessive exercise. Another is binge eating disorder, where someone eats excessively but doesn't purge afterward. These disorders can have severe physical and emotional consequences and often co-occur with anxiety or depression. Treatments typically involve therapy, nutritional counseling, and in some cases medication to address underlying mental health issue. Major depressive disorder, MDD. Major depressive disorder, often simply called depression. It's more than just feeling sad. It's a persistent feeling of sadness, hopelessness, and a lack of interest in activities once enjoyed. People with depression may also experience changes in sleep, appetite, and energy levels. The good news is, treatment is available through therapy and medications like antidepressants. Attention deficit hyperactivity disorder, ADHD, is usually diagnosed in childhood, but many people live with it into adulthood. It's characterized by inattention, meaning it's hard to stay focused or organized, and hyperactivity, where people may feel restless or impulsive. Someone with ADHD might frequently lose things, struggle with time management, or have difficulty following through on tasks. ADHD isn't just about being fidgety. It can make school, work, or daily tasks challenging. Obsessive-compulsive disorder, OCD. Obsessive compulsive disorder, or OCD, is characterized by unwanted, repetitive thoughts, called obsessions, and the urge to perform certain behaviors or rituals, known as compulsions. For example, someone might feel the need to wash their hands constantly to ease the anxiety of germs. OCD can be debilitating, but treatments like cognitive behavioral therapy and medications can help reduce symptoms. Substance use disorders. Substance use disorders involve the compulsive use of drugs or alcohol despite negative consequences. It can lead to dependency, where stopping the substance causes withdrawal symptoms. Addiction is a chronic disease, but with proper treatment, like therapy, medication-assisted treatment, and support groups, recovery is possible. Anxiety disorders. These involve feelings of excessive worry, fear, or nervousness that interfere with daily life. Common forms include generalized anxiety disorder, where people feel anxious about many things, often without a clear cause. Another type is panic disorder, where individuals experience sudden, intense bouts of fear, known as panic attacks, which can include heart palpitations, shortness of breath, and dizziness. There's also social anxiety disorder, where someone feels overwhelming fear of being judged or humiliated in social situations. People with anxiety disorders often avoid situations that trigger their anxiety, which can limit their lives.